Welcome to our YouTube channel where we explore the fascinating world of psychology. Are you curious about the inner workings of the human mind and what makes us tick? Do you want to understand why we think, feel, and behave the way we do? You're in the right place. We're here to take you on a journey of discovery, sharing insights and research from the world of psychology that will expand your mind and leave you wanting more. So hit that subscribe button and join us on this exciting adventure into the depths of the human psyche. Anxiety is a common trigger for nightmares. Anxiety is a psychological state characterized by feelings of fear, worry, and apprehension. It can be triggered by a range of factors, such as stress, trauma, or a perceived threat. Research has shown that people who experience high levels of anxiety are more likely to have nightmares. This is because anxiety can lead to hyperarousal, which can interfere with the normal process of sleep. When we are anxious, our bodies are in a state of high alert, which can make it difficult to relax and fall asleep. As a result, we may experience more frequent and intense nightmares. In addition, anxiety can also affect the content of our dreams. People who experience anxiety may be more likely to have nightmares that involve themes such as being chased or attacked, falling, or experiencing a life-threatening situation. These themes may reflect the person's fears and anxieties in their waking life. From a psychological perspective, treating anxiety can be an effective way to reduce the occurrence of nightmares. This may involve therapy, medication, or a combination of both. Cognitive behavioral therapy, CBT, is one approach that has been shown to be effective in treating anxiety and reducing nightmares. CBT focuses on identifying and changing negative thought patterns and behaviors that contribute to anxiety. So, anxiety is a common trigger for nightmares, and understanding the psychological mechanisms underlying this connection can help to develop effective treatments for both anxiety and nightmares. Trauma is a trigger for nightmares. Trauma is an emotional response to a distressing or disturbing event, such as physical or sexual abuse, combat, or a natural disaster. Trauma can have long-lasting effects on a person's mental health, and it is a common trigger for nightmares. Research has shown that people who have experienced trauma are more likely to have nightmares that are related to the traumatic event. So, while medications and substances can be effective treatments for certain conditions, these nightmares may involve re-experiencing the traumatic event, such as reliving a violent incident or experiencing feelings of helplessness or terror. In addition, people who have experienced trauma may have other sleep disturbances, such as insomnia or difficulty falling asleep. From a psychological perspective, treating trauma-related nightmares often involves addressing the underlying trauma. Therapy approaches such as cognitive processing therapy, CPT, and eye movement desensitization and reprocessing, EMDR, have been shown to be effective in treating trauma-related nightmares. These approaches help the person to process and reframe the traumatic experience, reducing the emotional distress associated with the trauma and the resulting nightmares. It's important to note that not everyone who experiences trauma will develop nightmares. However, for those who do experience trauma-related nightmares, they can be distressing and interfere with a person's ability to get restful sleep. Seeking professional help from a mental health provider can be an effective way to address trauma-related nightmares and improve overall mental health. Medications and substances as potential triggers for nightmares. Certain medications, such as antidepressants and blood pressure medications, have been known to cause nightmares as a side effect. Similarly, the use of certain substances, such as alcohol and drugs, can also contribute to nightmares. From a psychological perspective, the effects of medications and substances on sleep and dreaming are well documented. Some medications can alter the neurotransmitters in the brain that regulate sleep and dreaming, leading to changes in sleep patterns and an increase in nightmares. Similarly, the use of substances such as alcohol and drugs can disrupt normal sleep patterns and increase the likelihood of nightmares. It's important to note that not everyone who takes medications or uses substances will experience nightmares. However, for those who do, it can be a distressing experience. In some cases, it may be necessary to adjust medication dosages or explore alternative treatment options to address the side effects of medication-induced nightmares. For those who use substances, seeking professional help to address substance use issues can be an effective way to reduce the occurrence of nightmares. Also have unintended side effects such as nightmares. Understanding the potential effects of these substances on sleep and dreaming can help individuals and healthcare providers make informed decisions about treatment options and address any negative side effects that may arise. Sleep disorders as a potential trigger for nightmares. Sleep disorders such as sleep apnea, restless leg syndrome, and insomnia can all contribute to the occurrence of nightmares. From a psychological perspective, these sleep disorders can disrupt normal sleep patterns and interfere with the normal process of dreaming. For example, sleep apnea, a condition where a person's breathing is repeatedly interrupted during sleep, can lead to fragmented sleep and a decrease in the amount of time spent in REM sleep, which is the stage of sleep where most dreaming occurs. As a result, a person with sleep apnea may experience more vivid and intense dreams, including nightmares. Similarly, restless leg syndrome and insomnia can also lead to sleep disturbances that increase the likelihood of nightmares. Restless leg syndrome, which is characterized by an uncomfortable sensation in the legs that can disrupt sleep, can lead to fragmented sleep and more time spent in REM sleep. Insomnia, which is the inability to fall or stay asleep, can also lead to more vivid and intense dreams. From a psychological perspective, treating the underlying sleep disorder can be an effective way to reduce the occurrence of nightmares. For example, treating sleep apnea with a continuous positive airway pressure (CPAP) machine can improve sleep quality and reduce the likelihood of nightmares. Similarly, treating restless leg syndrome and insomnia with medications or behavioral interventions can also lead to better sleep quality and a decrease in nightmares. So, sleep disorders can be a potential trigger for nightmares, and addressing these underlying conditions can be an effective way to reduce the occurrence of nightmares. Seeking professional help from a healthcare provider who specializes in sleep disorders can be an effective way to diagnose and treat underlying sleep disturbances. Thanks for joining us on this journey into the fascinating world of nightmares. We hope you've gained a deeper understanding of the psychology behind these mysterious and often unsettling experiences. Remember, nightmares are a natural part of the human experience, and there are many ways to reduce their frequency and impact. Don't forget to subscribe to our channel for more in-depth discussions on the fascinating intersection of psychology. Don't forget to subscribe to our channel. See you next time.